Hello, dear colleagues. Welcome to Renix Academy and welcome to our OSCE tutorial. I am your tutor, Nurse Efere Victoria, and today we'll be discussing on manual removal of placenta. Manual removal of placenta. So, what is the indication for actually carrying out this procedure? This procedure is usually carried out when the placenta is being retained in the uterus. As I said when I was discussing on the active management of third stage of labor, I said normally placenta is supposed to expel on its own naturally, but a situation whereby the placenta is tucked in there after the normal time for placenta separation or placenta removal, which is usually within 15 to 30 minutes, placenta is expected to be out of the uterus. So if after 30 minutes, 45 minutes, we are still battling with removing placenta, then we have to go manually. So we're going straight into the procedure, but before the procedure is going to start, knowing fully well that manual removal of the placenta is a very delicate procedure, you are to explain the procedure to the patient and take informed consent. So hello Mrs. Ngozi, as you all know what is happening right now, that we've been trying to remove your placenta for the past 30 minutes and the placenta is not forthcoming. There is another way we can go about it, whereby we can remove your placenta manually. We have to use our hand into your uterus, but I can tell you for sure that it's not a very dangerous or harmful procedure. You are going to be fine. So are you giving us your consent to go ahead with the procedure? Okay, thank you so much. So my patient has been informed and my patient has given a consent for us to go ahead with the procedure. So the next thing is to assess for our vital signs. So what are the things needed for manual removal of placenta? Number one is your ebullient glove. The ebullient glove is needed because the glove is expected to be at your arm length, your elbow length, so that once you are going in, it will not be disinfected. Then we'll be needing our uterinic agents, that's your oxytocin. We'll be needing your oxytocin 10 international units. You'll be needing your examination glove to be able to check. Then you'll be needing your kidney dish to be able to receive the placenta, and then this also as well. So we'll be starting basically, but before you start, you have to check your patient, assess the patient's vital signs. You can just ask any of the maybe the nurse or anybody there, what are the patient's vitals. So the patient vitals is quite stable, the blood pressure is okay, the pulse is also okay, and you have to also check for any contraindication for the placenta to be removed manually. A patient that is suffering from placenta accreta. Placenta accreta is telling you that the placenta is being implanted into the uterus. Definitely, the placenta is not going to come out. That might involve maybe some surgical intervention. So at that part, a patient that has placenta accreta, you cannot do a manual removal of placenta for that kind of person. So after you've assessed the vital signs and you ensure vitals is stable, you've also checked for contraindication and everything is okay, you have to check for signs of placenta separation. Definitely is not taking place. So you can as well just try and see if you can still massage the uterus and maybe something can still happen. But if after massaging the uterus, doing the normal active management of third stage of labor, nothing take place, then we need to intervene as fast as possible to perform the manual removal of placenta. So first of all, you'll be needing your ebullient. So you have to don your glove, but before then you ensure you wash your hands in the normal way. So you wash your hands with soap and water because you are going into the uterus, so you have to apply all the aseptic precautions. So you are washing your hands thoroughly. Wash to the ebullient because you will be involving that area as well. So you wash your hand, you damp your hand with towel, So once your hand is dry, you're good to go. Then you put on your Herbal sterile gloves. So after donning your Herbal gloves, you pick your cotton swab with Savlon, that's your disinfectant. This is your non-dominant hand, right? Then you clean the vulvar area, because we are going into the uterus. So after cleaning, as I said before, you can still try again to actually give a massage and still see if it can pull out, and still try that cord control traction. But if that does not take place, then we are going inside the uterus. So you are using your dominant hand, you are going into the upper part of the uterus. So when your dominant hand is inside the uterus, you can locate that is inside the uterus. Then we are going to use a sweep-like motion, as if you are sweeping the uterus. You are going to see the placenta, right? Then you are going to try and use that sweep-like motion to be able to scrape that placenta cavity. So you are scraping each edges, each part, scraping it. So as you are scraping, it's like you are using your own hand to actually cause that separation to take place. So that is happening right now. I'm using my sweep-like motion. I'm doing that. I'm sweeping each edges. Maybe in a circular motion, just go like that. So after that has taken place, you are now going to remove. You could feel that you have already brought out the placenta. Bringing the placenta and its membranes out manually using your hand. Thank you. So most of the time, so that contraction can also take place, you have to administer oxytocin again. Lest we forget that we give oxytocin before. So most of the time, of course, you know that during active management of labor, they've given oxytocin, right, to actually bring out the placenta. But because the placenta is not forthcoming, we don't have to give again, because that one that we've given before is already working. So the only thing you can do is, after you've brought out the placenta manually, you can as well give another. Sometimes they give egometrine, cytometrin, but if it's oxytocin that your hospital, or depending on the OSCE guide, does, so you administer as well, just like a post delivery or post exposure oxytocin, so that contraction can as well take place. So after that, you are to also examine your placenta, the membranes, and check if it's complete. Then afterward, you have to also check again the mother, if there is any form of bleeding. You have to check if there is any form of tear. You have to also check if the uterus is actually contracting the way it ought to. Then you make your patient comfortable, you clean up your patient, you estimate blood loss. Yes, you estimate blood loss and ensure that it's not above normal, to ensure that, okay, bleeding is actually not taking place. And while you're also checking your uterus to check for contraction, is to ensure that there is no uterine atony, because if there is uterine atony, the patient will continue to bleed. So after your patient is comfortable, you've cleaned up your patient, of course, do the normal thing with your placenta, keep it to the receiver, then allow the significant other, hand over to the significant other. Then you clean up your trolley and you discard your gloves, you wash your hands and do the necessary things. Then ensure you document everything that has taken place. You thank your patient as well, and that's it. Another thing, very important thing to know, is that consent is very important in this procedure. So even before the whole start of the procedure, ensure that consent was taken. Thank you.